topic is going to be on elbow pain, and I get this question a lot from people whether they have golfer's elbow, tennis elbow, and they've done exercises for the forearm, they've gotten dry needling, they've gotten a lot of soft tissue work, and the pain is still there. And so one of the things that we found that with chronic elbow issues, whether it's golfer's elbow or tennis elbow, a lot of it's not actually coming from the elbow. Although you feel the pain at the elbow, the primary issue is not the elbow itself. What we found is actually your rotator cuff. So rotator cuff is basically the muscles that sit on the back of your shoulder blade and inside the shoulder blade. So muscles are responsible for keeping that joint in the socket. You'll find that people use that for throwing, those kind of things. So when you think about the mechanics of the shoulder can do a lot of different motions because it's a ball and socket. So one of the motions that we look at that's relatable or comparable to what happens at the forearm is internal rotation, external rotation. So if I were to externally rotate my arm, rotate it out, and also internally rotate, okay? The forearm does something very similar as well. It's supination, pronation. So if my elbow is locked, I can still turn the doorknob, rotate in and out. So it's a very similar motion, but coming from two different points of the body. Now, most people, if they've had elbow issues and let's say they've done dry needling and it's cleared it and it hasn't come back, okay, the issue might have been just at the elbow, but for chronic elbow pain, we find that if it doesn't go away, we have to address the shoulder complex, especially the rotator cuff strength, because they both do similar motions. So if that rotator cuff is weak, it's actually going to load the elbow a little bit more whenever you're doing things because it's not taking some of that force or some of that impact, resulting in you overusing the muscles that are actually in the forearm. So a really good exercise to help with that if you're having chronic elbow pain is specific rotator cuff exercises that I'll show you here shortly. All right, so let's assume that I have chronic elbow pain in this one. You have to keep in mind that if you're gripping too hard, it's still going to hurt the elbow. So there's options to this, but assuming that the elbow's only getting flared when it's something specific, whether you're playing the guitar, maybe you're hitting a golf ball or playing tennis, that's only when it starts to hurt and then it lasts for a few days. There's a way that you can actually just wrap this around the wrist, and I'm just going to act as if I'm not holding it, just keep it around the wrist. I suggest putting like some sort of like little towel here, and all you're going to do, step slightly out to where you feel some tension. Slowly rotate the elbow out, keeping it 90 degrees. You're not straightening it. You're keeping it here and rotating back to about neutral, not all the way in. We're going to kind of work with mid-range out. It's about right there, okay? Now, if you were to hold it, you could do the same thing, just wrap it around here, rotate out, and slowly come back in. Again, if you have more elbow pain, chances are you're going to need to wrap it around here. If gripping it is okay, you can put more of a loose grip, rotate out, and slowly come back in. A lot of people, when they do this, they tend to try to force their arm straight. They try to turn their body. We're just really trying to isolate the shoulder by setting it back before you start to rotate out and slowly go back in. We've seen it where people try to use dumbbells. It's not really the same thing when you're standing because you're getting a lot more bicep involved, and that can actually pull the joint in a different position. So using a band is going to be your best option, but that's one form of rotator cuff strengthening that will help the process of beginning to build shoulder stability to take some pressure off your elbow. For more tips on any of this stuff related to elbow pain, we're going to be putting more out to give you a better understanding of other avenues that you might need to take in order to help this chronic elbow pain.